Good afternoon, everyone. My name is Jennifer N. Bishop, and I'm the designated federal officer for the President's Council on Sports, Fitness, and Nutrition. Before we begin, I just wanted to go over a brief housekeeping item. And the first one is, due to the packed agenda, we are unable to entertain any questions from the audience. However, if you do have questions or want to seek clarification, please send them to fitness@hhs.gov. So fitness@hhs.gov. Just to reiterate, for those of you attending in person, if you need to exit the area while this meeting is in session, we do have some escorts in the back of the room who can help you, but you'll need to be escorted due to security concerns. So please find a volunteer in the rear, and we're happy to help you. Thank you so much for your cooperation. So I now call the annual meeting of the President's Council on Sports, Fitness, and Nutrition to order. But first, I'd like to invite Ms. Christina Harder, Acting Executive Director of the President's Council on Sports, Fitness, and Nutrition, up to the stage to conduct our roll call.
Hello, everybody. Good afternoon. My name is Christina Harder. I am the Acting Executive Director of the President's Council on Sports, Fitness, and Nutrition. I'd like to welcome everyone joining us here in person, council members here among us, and those who are on phone and online. We are honored that you would spend this time with us, and we hope you enjoy the wonderful program our team has in store. To begin, I'd like to conduct roll call. When I call your name, please indicate for the record that you are present. Misty May Traynor? Absent. Mariano Rivera? Absent. Herschel Walker? Absent. Chris Tizzy?
Present on phone.
Present. Robert Wilkins? Present. Jim Worthington? Present. Linda Yaccarino? Absent. Brenda Becker? Here. Present. Bill Belichick? Absent. Johnny Damon? Present. Trevor Drinkwater? Present. Robert Goldman? Present. Natalie Golbis? Absent. Nan Hayworth?
Present.
Present. Matthew Hesse? I believe he's joining us on the line soon, but for now, absent. Ashley Lundvall? Present. Jacob Olson? Absent. Mehmet Oz? We're waiting for him on the line as well. Shauna Robach? Present. Kyle Snyder? Absent. Julie Tier? Wonderful. Our total number of council members present, 11. Total number of council members absent, 10. At this time, I am pleased to invite Admiral Brett Giroir, HHS's Assistant Secretary for Health, to the stage. Admiral Giroir is the 16th United States Assistant Secretary for Health in the Department of Health and Human Services. He serves as the Secretary's principal public health and science advisor and oversees the department's key public health offices and programs, including disease prevention and health promotion, infectious disease and vaccine policy, minority health, human subject protection, 3 presidential and 11 secretarial advisory committees, and the Office of the Surgeon General. He leads HHS's fight against the opioid crisis, and he is with us here today. Thank you, sir.
Thank you very much. Hello, is this on? I think it is on. Well, thank you all. It's great to see you again. It's a little bit warmer in here than it was at the ice rink this morning. So this is your classroom time, okay? So I'm going to spend just a few minutes on the state of the science. And I think all of you know how passionately I feel about fitness as really a remedy for so many things that are going on in our health in our country right now. Can I have my slide set up, please? Or maybe I can't have my slide set up, please. Here we go, the state of the science. So I want to talk to you a little bit about the state of the science. I'm going to give you 3 downer slides. But don't worry, after the 3 downer slides, we're going to get to all the positive slides, because I really do believe that the people around this table, that you, can have as much to do with making America healthy as anyone on the planet. And I mean that very passionately, and that's why I'm here and feel so strongly about the President's Council. If you look at our state of the health, we spend a lot of money in this country. Almost 18% of our gross national product, $3.6 trillion, on its way to $6 trillion by about 2027. But because even though we spend this money, our life expectancy compared to our peer countries is very, very low. And in fact, our life expectancy has gone down in 2015 and 2017. What that means is we're the first generation in over 2 centuries that our children have the possibility of living less long than we do. And I know that's not acceptable to any of us. And we spend about 90% of our expenditures on chronic conditions. This is something that should concern all of us. About 3/4 of American youth, 17 to 24 years old, would not qualify to get into the military if they tried to join. And what are the reasons? Number 1, they're obese and out of shape. Number 2, they have substance use issues. Or number 3, they're not educated enough. And if we don't reverse this trend, our country will never be able to continue in its incredible legacy without fixing these things. And third, as a pediatrician, this is the only graph I will really show you, is that when we look at today's 2-year-olds, if we don't reverse the trend, this says by the time they're 35, 62% of them will be clinically obese. We have to really reverse this. And those are my 3 downer slides, but we do have the magic bullet. We have that silver bullet that can really fix so many of these issues, and it really is physical activity. In November, our office, with the great work of disease prevention and health promotion, again, Lieutenant Commander Piercy over there, and the whole office, we were able to announce the physical activity guidelines for America. Now, I'm going to tell you what those are and how it could affect all these health outcomes, but let me give you a couple little snapshots. This is looking backwards about how, what percent of the U.S. adults actually meet the physical activity guidelines, and it's very, very small. Less than 23% of adults meet the physical activity guidelines. But if you just met the physical activity guidelines that I'll tell you about, it is estimated that we could save $117 billion in healthcare costs and avoid 10% of all premature mortality in our country just by simple guidelines. Who's meeting the guidelines? Now let's look at boys and girls, and these are high school students. If you look from 2011 to 2015, about 30% of the boys and less than 15% of girls actually meet physical guidelines, even in that age group. Very, 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 very small number of people. So what are the guidelines, the new guidelines? If you're a small child, ages 3 through 5, you basically should be physically active through the day. That means you should have active play, kicking a ball, running around. My 2-year-old granddaughter's in constant motion, right? She has an on-off switch. That's what children are really meant to do, not sit behind a table and play video games the entire day. They really need to be active. When you're 6 through 17, it is advised that adolescents, children and adolescents, should have about 60 minutes a day of moderate to vigorous activity combined with muscle or bone strengthening activity. Moderate activity would be fast walking, it could be running, it could be dancing, it could be playing basketball, any of those type of activities. And muscle strengthening activities like jumping, playing basketball, doing weights, doing push-ups. Now, you know, we don't have to do 1,500 push-ups a day. I certainly can't do 1,500, but you need to do some. And adults, 150 to 300 minutes of moderate intensity aerobic exercise a week. Again, that's fast walking. It could be gardening. It could be walking upstairs. And very, very importantly, not like it was before that you have to do 10 minutes or 20 minutes or 30 minutes. Every second you do counts, and it all adds up. So if you just park further in the parking lot and walk up, that counts. If you take the extra stairs for 2 minutes, that counts. So this really adds up pretty quickly. And then again, some type of muscle strengthening activity. Could be weights, could be push-ups, could be anything that really strengthens the muscles in addition to your aerobic activities. So what are some of the long-term benefits to this? These are new long-term benefits that we announce. Physical activity prevents 8 types of cancer. Can you believe that? 8 types of cancer. It dramatically reduces the risk of dementia. Now, you know the problems we have with dementia and Alzheimer's disease. One of the best things you could do is just exercise. It lowers injuries from falls. It reduces postpartum depression. And of course, it helps with weight. If you already have disease, it decreases your pain from arthritis. It helps decrease hypertension and type 2 diabetes. You have a good feeling in your brain. It reduces anxiety and depression, and it really improves your cognition. Oops. Well, I wanted to show you this too. Alzheimer's is a very important disease. We think there are 4 to 5 million people with Alzheimer's, and by 2050, we expect it to cost about $1.3 trillion a year to take care of people with Alzheimer's. All you have to do, if there were a pill that did this, it would be the blockbuster of all blockbusters. If you have a high-quality diet, meaning don't eat ultra-processed foods, eat real whole foods that you normally get, you engage in cognitive activities like chess or reading or anything else, you have regular physical activity, you only have light or moderate alcohol intake and not smoking, you can reduce your risk of developing Alzheimer's by 60% if you have 4 of those behaviors compared to those who have 1 or 2 of those behaviors. That's really a remarkable item. Benefits for physical activity in youth, you know what they are. Great growth, great cardiovascular fitness. Most people don't know if that kids actually do exercise, they do much better on their test scores. They do better in school, they do better on their test scores, they have much better cognitive abilities, which is why all you guys are so smart and on the President's Council. And of course, youth sports participation, which we've talked about this morning, it really gives you that feeling of competence, of independence, of learning how to work on a team. All the things are important for the rest of your lives. What's our current youth sports participation? And we all know that. It's pretty low. It's about 54% overall, and that trend has gone down just slightly over the past years. And we know that not all people are affected equally. Girls have less opportunity than boys. If you are Hispanic or black, you have less opportunity than whites. If you're from a poor family, you have much less opportunity than others. So that 54% is sort of the best case, and there are many people we really leave behind. And that's, of course, why we were so excited today to be able, with your help, to announce the National Youth Sports Strategy that we believe will fix this problem. And I'm so excited that my office was able to provide $6.7 million in grant funding to 18 organizations across the country. I played Little League, I played every sport, I coached when our kids were there, and I can just really see what that opportunity will mean for so many people. The last thing I will say, and I think you know, is that we are starting again the President's Council on Sports, Fitness, and Nutrition Science Board. I hope this will be able to work in concert with you, because we always want to have the best science and evidence. We want to make sure that what we're doing is based in true medicine and true science, and that we're at the highest level of efficiency. If we could do X rather than Y or A rather than B, we really want that to govern us. So we really are very excited about restarting this board. And for everyone to know, we have call for nominations that are there right now that will close October 11th at about midnight. So again, I just wanted to share a few things with you. While many people are discouraged about how much money we spend and how poor our health is, really the best thing that we can do, it's better than any pill, it's better than any surgery, is regular physical activity. And if we can start that as youths, it sets a pattern for your entire lives, and we can really turn this around. So the key to this is really doing the things that you're dedicated to doing, and I want to thank you again for your dedication to this field, for your being here, and look forward to working with you in the future. Thanks.
Thank you. Thank you very much, Admiral Giroir. We really appreciate you being here. As you all know, in February 2018, President Donald Trump issued an executive order that refocused the mission of this council to focus on youth sports participation and increasing that nationwide. Shortly thereafter, he appointed all of you here on the council, and 1 year ago, this group came together for the first time in response to this executive order. The executive order also called for HHS to develop a national strategy to increase youth sports participation. And today, as Admiral Giroir just mentioned, we are very excited to officially launch and release the National Youth Sports Strategy, the very first federal roadmap intended to ensure that all youth have the access, opportunity, motivation to play sports regardless of their race, their ethnicity, their gender, their ability, or their zip code. The strategy is an important first step in achieving the charge laid out in the executive order from last year to expand and encourage youth sports participation. During the development process of the strategy, the Council had the opportunity to provide comments and feedback to HHS. Thank you for your insights, which helped us shape this final strategy. Change that for us. Thank you also to those who were able to join us this morning. We had an event with Secretary Azar, advisor to the President Ivanka Trump, and some of our local DC teams on the hockey field and on the baseball field, participating to help get the word out about this strategy. You'll be hearing more about the strategy later in the meeting, but you'll also have the opportunity to discuss your thoughts here with council members and ideas about how to implement this strategy. I'd like to take a moment first to recognize all the work that has been done this past year to further the mission of the Council. Just to highlight a few things, thank you to Dr. Oz, who helped us to launch the second edition of the Physical Activity Guidelines for Americans during an interview on the Today Show in November and on his show's website. In March, co-chair Mariano Rivera attended the opening ceremony of the 2019 Special Olympics in Abu Dhabi as part of the delegation led by Mrs. Karen Pence, Second Lady of the United States. In April, co-chair Herschel Walker gave a keynote speech at the American Medical Society for Sports Medicine annual meeting, sharing important information on the development of the National Youth Sports Strategy. In May, to celebrate the National Physical Fitness and Sports Month, the President's Council collaborated with James Madison University to host an inclusive youth sports festival at their University Recreation Center with over 100 local youth. A special thanks to Rob Wilkins, who was there and attended and participated in the activities with the kids. In July, Council member Linda Yaccarino, in her role with NBC Universal, hosted the Peacock Games in New York City to mark the one-year countdown to the Tokyo 2020 Olympic Games. Linda invited council members and the U.S. Olympic and Paralympic Committee, Sports Engine, and council member Julie Tier's organization, the Boys and Girls Club of America, to volunteer at this Olympic-themed event. Council member Ashley Lundvall and Rob Wilkins were able to join me at the Peacock Games to help inspire the next generation of Olympians. This past year, the Council reinstated the Community Leadership and Lifetime Achievement Awards. The Lifetime Achievement Award is given to individuals whose careers have greatly contributed to the advancement or promotion of physical activity, fitness, sports, or nutrition nationwide. Thank you to each of you for taking the time to review the award candidates and to help us determine this year's recipients. And congratulations, of course, to our 5 well-deserved winners of the 2019 Lifetime Achievement Awards.
I apologize that I am not able to.
I'm very sorry about that. Lifetime Achievement Awards, Dr. James R. Andrews, Donna De Verana, Dean Carnezas, Deborah Kibbe, and Jill Villiers. If you'd like more information, we would encourage you to check out our website, fitness.gov, to learn more about these exceptional individuals and to see the 31 recipients of this year's Community Leadership Award. I am also excited to announce that Mr. Scott Turner will be joining the President's Council leadership as a special advisor on youth sports. Scott is an incredibly gifted and dedicated individual who has made his mark in the world of both politics and in the world of sports. Most recently, he served as Texas State Representative for the 33rd District for 4 years. Before politics, he was an American football cornerback in the NFL for 9 seasons, playing for the Redskins, San Diego Chargers, and the Denver Broncos. Scott also currently serves as Executive Director of the White House Opportunity and Revitalization Council. He will be on detail to us here to help us implement the work of the National Youth Sports Strategy and to partner with these amazing council members that we have here today. Now, unfortunately, Scott has a very busy travel schedule with this Opportunity and Revitalization Zone work, but he is very happy to share a video message with you all, which I preemptively pushed earlier, but here you go.
Good afternoon. I apologize that I am not able to be there in person today. I'm Scott Turner, and I'm excited to announce my new role as Special Advisor to the President's Council on Sports, Fitness, and Nutrition. In this role, I will be working with the Council and HHS to help ensure that more kids can experience the benefits of youth sports. I'm currently also working as the Executive Director of the White House Opportunity and Revitalization Council. In this role, I'm traveling the country to encourage public and private investment in urban and economically distressed areas known as opportunity zones. I believe that one of the best ways to invest in communities is to invest in its children. And because of my background as an athlete, I know that one of the best ways to invest in kids is to invest in youth sports. Sports can give kids opportunities to gain new skills that they wouldn't otherwise be able to develop, like leadership, teamwork, and an understanding of the importance of a good work ethic. Kids who play sports are more self-confident, and they also do better in school. Sports are important to me, both professionally and personally. Through sports, I've had coaches and mentors who have helped lift me up and achieve success that otherwise would not have been possible. Sports taught me how to work hard. Success has not necessarily come easy to me. I've had to work for it, as all of you have as well. As a kid, sports motivated me to work hard academically. And as an adult, I took what I learned both on and off the field to help me succeed as a professional athlete, a former member of the Texas House of Representatives, and in my new role and work for the Trump administration. Not all youth have the same opportunity to participate in sports in our country. Only 41% of youth from low-income households play sports, compared to 76% of youth from high-income households. We all have to do better. That's why I'm looking forward to working with HHS and the Council to implement the National Youth Sports Strategy and make sure that all kids have safe, fun, and inclusive opportunities to participate in sports of all kinds. I'm looking forward to meeting you personally very soon and working with you on this very important initiative.
We are very thrilled to have Scott join our team, and we're confident that he will play an essential role in promoting and implementing the National Youth Sports Strategy, in addition to promoting other aspects of the important work that this council does. Lastly, as a quick update, we've recently undergone some big changes as part of a larger Reimagine HHS initiative. In June, we officially joined forces with the Office of Disease Prevention and Health Promotion, which now supports the work of the President's Council. The Council has historically worked very closely with ODPHP on initiatives related to physical activity and nutrition, and combining our efforts provides an opportunity to enhance the work of this Council. Now, I would like to introduce up next Carter Blakey, Deputy Director of the Office of Disease Prevention and Health Promotion. Will you welcome her with me?
Hello, I'm happy to be here today. As Christina said, we had Katrina and Christina. I'm going to get those mixed up all day. I'm the Deputy Director of the Office of Disease Prevention and Health Promotion, and also currently serving as the Acting Deputy Assistant Secretary for Health for Regional Operations. So I'm excited to be part of today's events, and I'd like to introduce you to the Office of Disease Prevention and Health Promotion and provide a brief overview of the reorganization that resulted in the President's Council moving to ODPHP. So let me scoot forward. So first, a little bit about ODPHP. We've been providing leadership in disease prevention and health promotion on behalf of the Secretary of HHS since 1976, when the office was created by Congress. So we're part of OASH, the Office of the Assistant Secretary for Health, led by Admiral Giroir. We work very closely with our other partner agencies or sister agencies within OASH, And in particular, I'd like to mention the Office of Women's Health and the Office of Minority Health, whose leaders are both here today, so you'll hear from them a little bit later. We also work with national partners and stakeholders. For example, we work closely with independent federal advisory committees who we rely on to review scientific evidence for us. We engage national stakeholders in both public health and healthcare to ensure that what we produce is relevant. And then we always work with our agencies within HHS and other departments as well across the federal government to ensure that our programs are consistent with national policies. So ODPHP's mission and portfolio is very wide. For example, we lead the Healthy People Initiative, which each decade delivers a set of national disease prevention and health promotion objectives with 10-year targets that are intended to improve the health of the nation each decade. We're currently in our 4th iteration of that initiative with Healthy People 2020, and we're looking forward to releasing the 5th generation of Healthy People in March of 2020, so it'll be Healthy People 2030, so stay tuned for that. We also manage a National Clinical Care Commission that is another federal advisory committee that's developing a report with recommendations for federal programs related to diabetes. We manage 2 national action plans aimed at improving healthcare quality. One is the prevention of healthcare-associated infections, and the other one is looking at adverse drug events. Then we encourage consumers and the American population to adopt healthy lifestyle practices and receive the recommended preventive screenings and other services through our consumer-facing website called healthfinder.gov, where we take scientific information, complicated medical information, and put it in a form that we hope the general population can understand and act on. And all of this is part of our efforts to improve health literacy of the country. And perhaps some areas that you're most familiar with would be our efforts to develop 2 sets of national guidelines. One is the Dietary Guidelines for Americans that we produce every 5 years in partnership with USDA to provide science-based, food-based guidance to encourage Americans to eat well and stay healthy to prevent chronic diseases. And the other set, of course, I hope you know about, is the Physical Activity Guidelines for Americans that Admiral Giroir mentioned earlier. We just this year launched our 2nd iteration of those guidelines. And again, those are science-based guidelines aimed at improving health through physical activity. And now we embrace you all. You all are now part of our portfolio as the President's Council on Sports, Fitness, and Nutrition. So we're really dedicated to ensuring that the work you do is fully supported now by a larger office. So I'll give a little bit of an overview on this reorganization process that you've heard about. So it was called OASH, not OASH, but HHS Reimagine, and it identified organizational changes that were intended to improve HHS's public health portfolio by making recommendations that would streamline and strengthen our organizational structure. And a result of that was the combining the integration of the President's Council into ODPHP. And we see this as offering a lot of positive opportunities. We've always worked together with the President's Council, with ODPHP providing the subject matter expertise and the scientific expertise through the Dietary Guidelines for Americans and the Physical Activity Guidelines for Americans that actually helps the Council do its work to increase sports, physical activity, and healthy eating habits. So again, we want you to know that we're dedicated. You now have a staff of about close to 30 people ready and willing to help you get your work done. So welcome to ODPHP. So I'll talk a little bit now about the development of the National Youth Sports Strategy that you all got to participate in the launch of this morning. This is really a natural synergy between the President's Council and ODPHP. And as Christina mentioned, it was developed in response to a presidential executive order. So about a year ago, ODPHP was asked to take the lead on the development of the National Youth Sports Strategy. And to get this going, we established an executive committee that was made up of representatives from the Office of the Assistant Secretary for Health, the Centers for Disease Control and Prevention, and the National Institutes of Health. We also formed a federal steering committee that had much broader representation from across the Department of Health and Human Services. And then, of course, you all played a big role by providing your input on the draft strategy. Now, we followed what we call our tried and tested model for developing guidance by seeking input on science from our stakeholders and from the public. What we did when we first got this assignment was to take a look at what was going on already in the department to see where we were, what were we benchmarking our work with, and where did we possibly need to go, what gaps needed to be filled. We conducted a literature review and did an environmental scan, and when we did that work, we realized that the science that we were looking at, the research that we found in youth sports, was a bit different from what we would typically find with our other projects, for example, the dietary guidelines or physical activities, for example, and that there are practitioners in the community that are doing really good work, but they might not necessarily be the type of folks who would publish in scientific peer-reviewed journals where we typically go to find some of our data. So to ensure that we captured all of this important information, we first put out a call for input on the 4 pillars of the executive order. And in response to that, we received well over 100 comments. And to make sure that we still got the input we needed, we convened a public listening session in April of 2019, where we heard from 16 organizations that gave us information on all sorts of activities, including coach recruitment and training, programming, best practices, and perhaps most importantly, we heard about strategies for engaging and reaching the underserved populations, which is a priority for us. So now that we had all of this information that we had collected from different modes, our executive committee got to work and they developed the draft strategy that went out for public comment over the summer. And as a result of that public comment, we had input from members of the public, we had other federal departments who provided comments, we heard from non-federal organizations, and of course we had input from you all when you reviewed the draft report before it went out for public comment. We also sent the draft report out for peer review with 7 subject matter experts in youth sports and academia. And then the final step in developing the strategy was to go through what we call departmental clearance. That allows agencies across HHS to look at the report and ensure that it is consistent with departmental priorities, and it is aligned, and we're delivering the same message. We don't have one agency saying something while we're saying something else. So that was the final step in the development process. So with that, I'm going to call Katrina Piercy up to the podium, and I think some of you met Katrina. I know all of you met Katrina earlier today. Katrina was the project lead in developing the National Youth Sports Strategy, and she'll provide some details and key takeaways on the strategy. So, Katrina, the meeting is yours.
Thanks, Carter. So I'm going to dive in a little bit deeper. So I really appreciate everybody being a part of the launch this morning. We've been talking about it, but let's talk a little bit about what's in it and what we're doing next. And I think this will help set the stage for the discussion the council members are going to have this afternoon about how they can really play a role as we move into the next phase of the implementation of the National Youth Sports Strategy. So this basically outlines what I'm going to talk about, but let me focus first on what are the key pieces to take out of this. So to remind you where this all came from, we've mentioned before that this project came from an executive order from the president, and that outlined 4 key pillars that we were going to focus on: to increase the awareness of the benefits of youth sports, to promote private and public sector strategies to increase participation, to develop metrics to gauge youth sport participation, and finally, to establish a strategy to recruit volunteers that would be engaged around youth sports from coaching or other areas. And all of this, looking at this from the lens of underserved and populations that really have either lower rates of meeting the physical activity guidelines or lower rates of engagement in youth sports. We saw some data earlier from Admiral Jawar, and we know there are tremendous disparities in youth sports participation. So we really approached this with a public health lens and thought about how can we do this to get this information out there and help all kids have this opportunity. So I should note, if you looked closely at the pillars out of the executive order, that they do mention the importance of regular physical activity and the importance of good nutrition. And I have up here on this slide 2 of our key pieces from 2 of our recent policies that Carter mentioned: the Physical Activity Guidelines for Americans, which we launched last November, and then the dietary guidelines. You see the My Plate icon here. We felt like that we had, on the federal government side, really have covered physical activity and nutrition with those 2 policies and their corresponding communications campaign, that being the Move Your Way for the physical activity guidelines and Choose My Plate for the dietary guidelines. So we made a decision for this youth sports strategy to really focus on the youth sports piece. So in the document, we've pointed people to the nutrition and the physical activity policy and the science base and to the communications campaigns for each of them. But we really decided and made a conscious decision to really focus on youth sports and felt like that this was an important piece to carve out. Not to say these aren't important, but they aren't the focus of the strategy itself. So you've seen this a few times. It's important to iterate again here. What we thought about when we put together the National Youth Sports Strategy was realizing this is the first time that the federal government has set up this roadmap and written this up. And so we're realizing that we're not going to change this overnight. The culture in the United States, there's a lot of things that we can do to improve things, and we have a long way to go. But really saw our role to kind of unite everybody around a shared vision. So hopefully you've seen this phrase before, hopefully you'll see it again before, but this is kind of our uniting piece that one day all youth will have the opportunity, the motivation, the access to play sports, regardless of race, ethnicity, sex, ability, or zip code. And I think that's really kind of how we're pointing this North Star forward of how do we think about the different strategies, think about the different opportunities that we can really open this up for everybody. So how did we do this? As Carter mentioned, our process of how we develop the National Youth Sports Strategy, we tend to go to the science first. When we're doing the guidelines itself, we start there. And realizing that most of this work has been done in communities, is done in programs already. And there was not a science base per se in the same way that we would look through the peer review literature. But we found our science base by looking to the communities and to the organizations that already had tried and tested strategies to increase youth sports participation. And this fits in nicely with the second pillar of the executive order of identifying and promoting these strategies of kind of what works. So we pulled all of this information together and then organized it around a framework and really came down to the message of that everyone has a role to play around youth sports. And so we developed this framework based on the social ecological model, starting all the way with kids themselves. So they have a role. The parents have a role. Anyone who's interacting with kids, the coaches, the volunteers, the organizations have a role, communities have a role, and the public policy level has a role as well. So there's a lot of information up in the screen. It's blown up a bit bigger in the actual youth sports strategy, but that was our way to kind of put all the pieces together. We end up with over 50 strategies of different things that can be done around youth sports. And these are things that are already being done in different communities and already out there. This was just our way to organize it and give people a starting point. So the next few slides, I'm going to talk through a few of these strategies for the different levels, so you can see about where your opportunities may be. So let's talk about kids, starting at the bottom, at the center. So things about talking with them about the benefits of playing sports, figuring out the opportunities. Sometimes it's just making sure that they're aware of, hey, there's something that you could sign up after school to do this activity. The kids themselves, asking them what they want and asking them to talk to their parents, handing them information at school and saying, hey, you can sign up for this program or this league, or if you want to stay and do this, they can help bring that to their mom and dad or their caregiver and say, hey, can I join this? Can I be a part of this? The other piece that really came out really strong when we were pulling together the information was the importance of sports sampling and physical literacy. What does that mean? Sports sampling is playing a variety of different sports and activities. Technically, it's defined as playing more than one activity over a 12-month time period. So this is the idea. Many kids nowadays, 8, 9, 10 years old, are playing one sport year-round, multiple leagues, summer, winter, travel, school, club. It's a lot. And so a lot of the research that's coming now is saying, maybe this isn't the best thing to keep them in one sport, but trying a variety of different sports and activities. There's many different activities that count for sports, that are teams, that are individual things. So parents and kids themselves can try different activities to find something that they like, building up that confidence. And the other benefit of doing lots of different sports is the development of physical literacy skills. And that's thinking about how to develop the confidence and the competence to do different activities. So how to kick a ball, how to play a certain game, what are the rules of this, how to cradle a lacrosse ball. I have a 3-year-old at home, and I've almost had forgotten that you have to teach these skills. So I was teaching him how to jump the other day. And this is something that kids can learn. And this is a role that they can, try one activity and learn those skills, and then try another activity and learn that. And these will all help them throughout life. So adults, all of us here in the room today have a role. Whether you're a parent, whether you interact with kids in some capacity, we can get involved. We can be a coach, a volunteer, an official. We can be a role model ourselves by doing physical activity ourselves, by inviting it to do it with kids, by just having kids seeing adults play sports. There's tons of adult leagues nowadays, and it's great for kids to watch adults play and realize, hey, they can still enjoy this too. Making it about fun. And that's a key theme that came out multiple times, that this should be fun. And if we're having fun as adults and we're showing kids and modeling that, that helps a lot. And finally, promoting learning over competition. So again, what did you learn from that game? It might have been a win, a loss, it doesn't matter. But what did you learn? What can you take away? What could you do differently? Learning a skill, did you figure out how to kick with your other foot or something like that versus just what is the wins and losses? For organizations, thinking about how to make programs accessible and inclusive so all youth can participate. There's often little tweaks that can be done that make a huge difference. Thinking about coaches and volunteers that are brought in and that are appropriately trained. Also, we know that coaches and volunteers that reflect the community demographics do really well. So think about who's already living there that could help be a role model for kids. Again, going to that sports sampling piece, playing a variety of sports throughout the year. Sometimes it's the coaches that are saying, you need to pick, you need to drive into one. We want to be encouraging kids to try multiple activities, especially as they're young. And then thinking about sports to build confidence. And as parents, we can help them do that, encourage them, make this a positive piece. At the communities, similar pieces here about safe and accessibility. So that's thinking about how to get to the space itself, and then making sure that it's a safe place that everybody can be included and be a part of it. Also at the community level, thinking about coalitions and how can we combine forces, how can different organizations within a community collaborate and work together to advance a youth sports program? How can we involve business owners and other community groups that could pull resources together or could share things or maybe can share use of a specific athletic facility? There's lots of creative ways, but a lot of it around collaboration can make a difference. And then finally thinking about the public policy, public agenda side of things. And so this is a piece that the federal government's a part of, that state government, that local government is a part of. Thinking about things, how to collaborate again, funding, grants. You're going to hear from next, the Office of Minority Health and the Office of Women's Health. Tremendous work they're going to be doing with the YES grants. So this is a great way to put funds into populations and into communities that really could use it and start to move the needle. Thinking about spreading the word about the benefits of youth sports, sometimes just getting that information out there, and then thinking about policies and different things that can support access and opportunity for all. I wanted to highlight here, so it's a little bit difficult to see on the screen, but throughout the National Youth Sports Strategy, one thing we thought was important was to look at all of these different strategies. So I said there's over 50 in here, but finding some communities and some organizations that are already doing great work around youth sports. And so we have 6 bright spots that are in the National Youth Sports Strategy. And each of these highlight a different program that is combining several of these different strategies, and they found a way that it works for their population. And so these aren't an endorsement of this is how it should be done, but more of here's an example. Here's a creative way that this community is, reaching girls by having more female coaches, or a creative way, Saturday Night Lights, that is bringing kids off the streets on Saturday nights and into a sporting facility in New York City, that's using funds through their judiciary program. So there's different ways to think about how we can get youth sports to the kids, and these are just some different opportunities. This next slide just highlights the name of them. Again, just a snapshot of really what's going on. There's some great work that's already happening. I think what we can do now is just continue to get that information out. How can we think about spreading what's already happening? So just flipping gears, so I've talked kind of big picture, what's in the strategy itself. If you want more pieces, everything is available on our website, health.gov. The bright spots, we're going to be doing a blog on each of them so we can continue this information. So if you're interested in one of the programs, we have more of the details for what they have done and kind of spotlighting each of them. There's also a partner promotion toolkit. This has all of the social media messages and things to be able to share and get the information out. There's also a really quick guide, so if you want the Cliff Notes for the National Youth Sports Strategy, the top 10 things to know. It's a real quick read that'll give you kind of your quick and dirty, what do we need to know about it? The executive summary, so a few more pages, and the executive summary actually has each of the strategies laid out. So for each of the levels of the framework, you can read more there, and then also some frequently asked questions to give you some more background about it. So shifting gear a little bit about where we're going from the HHS side of implementation, and then kind of setting the stage for where the council members can be involved as we move forward. So big picture, a lot of pieces that we're looking at on the HHS side of how we can engage more around the communication and the promotion, about measuring youth sports, about partnership and stakeholder engagement, and then as well federal government coordination. So a number of pieces that we've got on this. So talking more about the communication, this is a perfect piece for where the council members can be a part of this, and we'll talk more this afternoon about how they can engage, how they can help promote through their networks, and everyone here today as well. I mentioned the Move Your Way communications campaign, and this is part of what we've done with the physical activity guidelines. That's our piece to help deliver messages about the importance of physical activity. We're going to be expanding that to add a youth sports piece that we'll be rolling out with National Physical Fitness and Sport Month next May, but we'll be adding on a piece to really emphasize how sports can help kids meet the physical activity guidelines. Measuring youth sports participation, so there's a lot of work that's being done on the federal side, and also a lot of work that's collecting sports data on the non-federal side, but thinking about how might we be able to standardize some of it, to think about when we're restructuring questions, is there ways to be able to ask the same questions so we can make some comparisons. Also, Carter mentioned our office leads Healthy People 2030. We have an objective proposed that will track youth sports participation, and that will kind of help elevate the importance of youth sports within the Healthy People physical activity objective. Partnership and stakeholder engagement, and this is where a lot of you in the room and probably watching may be interested in. We're looking to think about how we can engage and work more with the organizations and groups that are already in this space. You're going to hear later this afternoon from the National Fitness Foundation and how we can be working with them to advance this work. Admiral Jawar already talked about the science board, so that we will bring in a group of academics to help provide this translation piece from the work you all are doing on the council, and also thinking about what other information can we help get out there. And then finally, how can we think of some creative ways to partner and engage with other groups? And then lastly, from the federal government side, as Carter mentioned, our merge with the President's Council coming into ODPHP that adds more resources and more support for the council. We're also looking kind of across HHS of how we can collaborate with other offices, across HHS, outside of HHS, around physical activity and youth sports. And then finally thinking about, lines up perfectly with the next talk about grants and programs. This project has brought Office of Minority Health and Office of Women's Health. We've been working more with them and look forward to more collaboration, thinking about what can we learn from these different grantees. And finally, I just want to say a thank you to everyone who has touched this project. It's been a fairly quick one that we have pulled together a lot of pieces. We've leaned on a lot of stakeholders, asked a lot of people for their input through public comments, through peer review, through reading the draft of it, and just wanted to say a thank you because this has a lot of fingerprints on it, and I think we got to a great starting point, and we're excited to see where we go for implementation. So with that, I'm going to introduce our next speakers to talk about the exciting pieces as part of things. So Captain Felicia Collins from the Office of Minority Health and Dr. Dorothy Fink, who will be talking about, from the Office of Women's Health, be talking about the Youth Engagement in Sports Initiative.
Well, thank you so much, Katrina. We have really enjoyed hearing from all of you today so far, and we are excited to talk about our project in the upcoming presentation. And so on behalf of the Office of the Assistant Secretary for Health, Captain Collins and I are pleased to be here to announce our contribution on the President's plan to support the growth of organized sports for both girls and boys, particularly in areas where few programs exist. Our program is named Youth Engagement in Sports, Collaborations to Improve Adolescent Physical Activity and Nutrition. It is also known as the YES Initiative, and we are here to announce the awardees. Before we get to the awardees, let me give you a brief overview of the Office of the Assistant Secretary for Health, or OASH, where my office, the Office of Women's Health, and Captain Collins' office, the Office of Minority Health, are located within HHS. Both Dr. Collins and I will provide you a brief overview of our offices, along with an overview of the YES Initiative. As I just mentioned, OWH and OMH are part of the Office of the Assistant Secretary for Health, led by Admiral Brett Giroir, whom you heard from earlier today. Admiral Giroir's vision for leading America to healthier lives has 3 pillars: health for all, health by all, and health in all. The first pillar, health for all, is directly aligned with the activities that support women's health and the health of racial and ethnic populations and communities. On the next slide, you'll see a little bit more about my office, which was established in 1991 to improve the health of U.S. women by advancing a comprehensive women's health agenda. Our vision is for all women and girls to achieve the best possible health. We provide national leadership and coordinate to improve the health of women and girls through policy, education, and innovative programs. This slide also highlights various OASH partners that significantly contributed to the development of our YES initiative, including the very own President's Council, thank you all, and the Office of Disease Prevention and Health Promotion, and the Office of Minority Health. As Admiral Giroir stated earlier, the Office of Disease Prevention and Health Promotion recently released the 2nd edition of the Physical Activity Guidelines for Americans, calling for youth to engage in at least 60 minutes of physical activity a day. This guideline is a foundational underpinning of the YES initiative. Captain Collins' office, the Office of Minority Health, is our partner in this project for implementing and monitoring these grants. And now I'm going to turn it over to Captain Collins. And I will just say that what I really love about my job here is that I'm a pediatrician, Captain Collins is a pediatrician, and so we really love teaming up and really thinking about how the health of our youth impacts the health of our entire nation. So hand it over to you.
Thank you. So good afternoon, everyone. Again, my name is Captain Felicia Collins, and it is my pleasure to join you today in support of the National Youth Sports Strategy and the YES Initiative. Let me begin by briefly telling you a little bit about the Office of Minority Health. Federal efforts to improve the health status of racial and ethnic minorities date back to at least 1985, with the release of the report of the Secretary's Task Force on Black and Minority Health, also known as the Heckler Report. This was the first national report on the status of racial and ethnic minority populations within the United States. A year later, the Office of Minority Health was established, and our mission is to improve the health of racial and ethnic minority populations through the development of policies and programs that eliminate health disparities. I want to echo Dr. Fink's point about the importance of partnerships. In a setting of limited resources, it is critical that the Office of Minority Health partner with other offices within the Office of the Assistant Secretary for Health and other offices across the Department of Health and Human Services and across government in general. One of the reasons that we are so excited to be with you today is because the YES initiative is emblematic of how cross-collaboration within the department enhances our development and our implementation of grants and other activities that support the OASH vision and the pillar of health for all. Another example of a collaboration within OASH that is particularly relevant to today's discussion about physical activity is the active and healthy theme of the Office of Minority Health, which we adopted for the 2019 and 2020 National Minority Health Months, which we celebrate April annually. Our focus is to encourage individuals, children, youth, and adults to engage in some type of physical activity every day, consistent with the physical activity guidelines and the Move Your Way campaign, which, as we've heard, was developed by the OASH Office of Disease Prevention and Health Promotion. So OASH believes in data-driven activities, and so I want to highlight for you that the YES initiative is supported by data reported by the Aspen Institute, which is an organization that seeks to inspire solutions that help sports serve the public interest. This slide highlights data from the Institute's 2018 State of Play report, and it shows the impact of income and gender on sports participation. We've seen some data in this regard earlier, but indulge me as I share you the results of this report. The first two bars on the far left side of the screen show the impact of income. 33% of parents making less than $50,000 a year annually say that youth participation in sports is just too costly. And so that's the blue bar. And that is in comparison to 17% of parents making over $50,000 annually, which is the gray bar. If we go to the two bars in the middle, they also speak to the issue of the impact of income on sports participation. In the blue bar, we see that 75% of children from households with income at 400% of the federal poverty level are in team sports or participate in some type of lesson, while the gray bar depicts that only 42% of children from households with 100% of the federal poverty level participate in sports or activities. And then last, but certainly not least, the third set of bars compare sports participation between boys and girls, with 60% of boys being engaged in a sports team or lesson, shown by the blue bar, compared to 49% of girls, shown by the gray bar. So the YES initiative that we are so pleased to be able to discuss today with you seeks to identify best practices for addressing these income and gender differences in youth sports participation and in support of the National Youth Sports Strategy. The Office of Minority Health and the Office of Women Health developed the YES initiative in consultation with you all from the President's Council, the Office of Disease Prevention and Health Promotion, and the Office of Adolescent Health. Today, the Office of the Assistant Secretary for Health is investing in our youth by providing more than $6.7 million in grants for the YES initiative. We are very excited about providing support to grantees to develop programs that expose 6th, 7th, and 8th graders to a variety of sports activities. This will include traditional sports such as basketball and softball, and potentially exposure to other types of activities such as hiking or mountain biking. These grants will spotlight strategies for reducing barriers to participation in organized sports by promoting sports clubs and leagues for children and youth, particularly among racial and ethnic minority communities, girls, and for other disadvantaged youth. We anticipate that grantees will include a variety of partnerships with various local organizations, such as community recreation centers, sports organizations, public health organizations, local schools and higher education institutions, and tribal organizations, just to mention a few. Through sports participation, YES grantees will move our youth towards meeting the National Physical Activity Guidelines that call for youth to engage in at least 60 minutes of physical activity each day. Of note, in addition to increasing youth participation in sports and physical activity, YES grantees also will be promoting healthy eating by encouraging increased consumption of vegetables and reduced consumption of sugar-sweetened beverages. And now, without any further delay, I will ask Dr. Fink to announce the grant recipients.
Great, thank you so much, Captain Collins. And we are really excited to introduce you to the awardees. You can see the map here, and we will go in alphabetical order. So first is the Carrie Steele Pitts home in Atlanta, Georgia, the city of Pine Bluff in Arkansas. Florida introduces physical activity and nutrition to youth in Fort Lauderdale. Hayward Unified School District in California. Herbert Hoover Boys and Girls Club of St. Louis, Missouri. I Challenge Myself in New York. Lindsay Unified School District in California. Native American Community Academy Foundation in Albuquerque, New Mexico. Philadelphia Youth Sports Collaborative in Pennsylvania. Rural America Initiatives in Rapid City, South Dakota. Seattle Children's Hospital in Washington. Texas Health Research and Education Institute in Arlington, Texas. The curators of the University of Missouri on behalf of the University of Missouri, Kansas City. The Skills Center in Tampa, Florida. The University of Alabama at Birmingham. Up to Us in New York. The YMCA of Greater Louisville. U-Rock Tribe of U-Rock Reservation in Klamath, California. As Captain Collins said, the YES Initiative projects will develop and implemented sports fitness programs based on successful evidence-based practices for youth engagement and result in the identification of model sustainable strategies that increase participation in a range of sports and activities that support a healthy lifestyle and improve overall health. It is a great pleasure for all of us to be a part of this event and to be contributing to this collaboration. As we look forward to learning more about our grantees and the next steps in this process, we really want to thank the committee here, and we'll say that we really are thankful to have this opportunity to address these factors that create better health for children throughout America. Thank you very much. And then finally, I'll just say on the last slide, if any of you would like to look at our websites, the Office of Minority Health, the Office of Women's Health, we have some really great sites, and you can also follow us on all the social media sites listed too. Thank you.
All right. Good afternoon, everybody. My name is Chris Benz. I'm with Special Olympics International. And it's just great to be here today to hear about all the work that you're doing that ties in so perfectly with all of our health, nutrition, sports work, and inclusive health work that we do on a daily basis and across the world. So thank you for having me here today. It's a great plug earlier about Unified Sports, one of our great platforms where people with and without disabilities play sports on the same field together, because that's actually how myself and Novi here met. What was it, Novi, about 8 years ago, right here on the sports fields of Washington, D.C. Novi wrote a very long bio for me to read, Novi, so I'm only going to read a couple of things. I think you're going to touch on it here in a little bit, but Novi is actually, as of this March, a colleague of mine. She works in the marketing department at Special Olympics International. Novi plays several sports. I'll read all of them here real quick. Bocce, basketball, flag football, tennis, bowling, volleyball, and track and field. I'm actually her coach, a long jump coach, track and field. So Novi is very active. You might say, hey, she looks kind of familiar. Where have I seen her before? Last summer, and she was actually one of the faces for United Airlines campaign. So she was plastered all over the airports around the United States as part of their Superheroes campaign. Novi was also chosen to be on the bocce team for Special Olympics DC at the 2018 USA Games in Seattle, Washington. So you might have seen her on ABC or ESPN last year. She won a gold medal. She'll tell you all about that in a second. But most importantly, Novi is one of my best friends. And so without Unified Sports, without Special Olympics, without all the programs that we do together, we would not have this amazing relationship. So thank you for having us here. And please welcome my colleague, my teammate, and my really good friend, Novi Craven.
How's everybody doing? Good, good, good. Hello, council members, and thank you for inviting me here today. The work you're doing to increase sports participation among youth of all backgrounds, abilities, and to promote healthy and active lifestyles is so important. I don't know where I would be without sports in my life. I was born premature. I have cerebral palsy, serious food allergies, and asthma. I'm also very ADHD. I spent the first 22 months of my life in Howard University Hospital. When I was 3 years old, my mother started getting me involved with sports and dance programs in the recreation department near where I lived. I was receiving a lot of physical and occupational therapy, and she thought this would help me make progress and would be a way to meet friends and burn off some of my energy. She wanted me to have the opportunity to be around kids who did not have a disability. The first sport I remember doing was basketball, and today in Special Olympics, that's still my favorite sport. I did every sport available but tackle football. That was only because my mom refused to let me play tackle football. However, she let me play flag football. I remember I got so strong from doing all my different sports that I busted right out of my knee-high leg braces, and the doctors and the PTs were amazed at how much progress I had made. Sports also helped me to learn to focus. It gave me a place to appropriately get out my extra energy. Sports gave me something to look forward to after school. Sports gave me a place to learn appropriate social skills from other kids my age. I play sports because I have a competitive nature, and I'm very social. Sports gave me a place to channel my energy and be free from people telling me to sit still. When I play sports, it helps me with my focus. I enjoy the teamwork and building relationships both on and off the field. As a child, I struggled with learning disabilities, and school was very hard for me. I went to school exclusively for kids with learning challenges and other disabilities. Sports were unifying for me because one of the things I wanted most was to be like other kids my age. Sports gave me a place to feel good about myself. Sports also gave me valuable mentors in my life. I grew up in Tacoma, D.C., and I've been raised by a single mom. Sports gave me positive role models. One of those was Steve Francis, a former UMD star and NBA star, who grew up close by. He gave funds so the basketball league could be affordable for everyone, and his friends were the coaches and were mentors in the Yes Youth Exposed to Success League. I was the only girl who played in that league, and I was smaller than anyone, but that didn't stop me from participating. I felt so included and won several awards while playing in the Yes League. The other really positive experience I had as a middle schooler was with the 4D Police and Boys Girls Club. There I had police officers who mentored me, helped me with my homework, and coached us in football, cheerleading, basketball, and baseball. I still see some of the police officers and kids I played sports with who are now growing up and working in jobs such as Metro bus drivers and aides to people with disabilities. I always knew that the police in my neighborhood were caring people because of the relationships I had with them when they coached me in my sport. Today, sports are still a huge part of my life. After graduating from high school, I found it hard to meet people who were like me and get exercise. I was sad and felt alone. A family friend suggested I contact Special Olympics. I still remember going to my first sport, which was unified bocce. I felt so welcomed, even though I didn't know anyone or anything about bocce. One of the things I love best about Special Olympics unified sports is that we come together as one, and athletes who have challenges work and socialize with partners who do not, and we learn to help each other. I now play 7 sports at Special Olympics DC. In the summer of 2018, I was invited to Seattle, Washington, to compete in the Special Olympics National Games, and guess what? Bocce. I brought home gold and bronze medal, and a 4th place. I also brought home a 4th place ribbon. My favorite sport in Special Olympics, however, is still basketball. For the last 2 years, my unified basketball team has won the gold medal. I am one of the 200 trained health messengers for Special Olympics. I promote health and inspire others to be fit and healthy. 10 years later, through Special Olympics, I've met valuable friends and mentors. I've learned new skills, and Special Olympics has even turned into a career for me. I am passionate about sports and Special Olympics and want to help get the message out to more people with intellectual differences. That Special Olympics is a free program where they can play sports and work on staying healthy. I'm here today speaking before you because of sports. I believe that all children deserve low costs or free opportunities to play sports. We need more funding for programs like Special Olympics, the Boys and Girls Club, and recreation departments. Everyone cannot afford elite sports and teams and AAU fees. We need more opportunity for kids to get exercise, learn to eat healthy, and have a healthier lifestyle. More sports to promote peace and social justice. Sports saved me, and everyone deserves to play sports. Thank you for inviting me here today to share my story. I hope it changed your ideas of what people with intellectual differences can do.
All right, how's that for inspiration? Now, we're going to take a short break. Our break will last for 15 minutes. Please remain seated as the council members exit the Great Hall.
Produced by the U.S. Department of Health and Human Services at taxpayer expense.